That was Nick Jones reporting. We just learned within the last couple of minutes that Myrtle Beach is going to rescind their order and open beaches. The governor, Henry McMaster, is now meeting, discussing the latest out of his Accelerate South Carolina task force meeting. Dr. Linda Bell with DHEC is at the podium now. Let's listen in.
We are monitoring modeling to look at when we will, from a variety of different measures. I think the one from the University of Washington is looking at when we would see the peak in hospitalizations and the peak in deaths. So that's one point in time, but those models are dependent on how successful we are in maintaining the restrictions that we've all been talking about. If we begin to relax some of the restrictions and then people take for granted that that we're reopening everything, that's not the case. So if they do not continue to practice those protective measures, then there's the risk for increased transmission in the community, which would change those projections that we've made. So, so the virus doesn't recognize a date on the calendar. We're just looking at projections, and those projections are entirely dependent on the social distancing measures that are in place.
Should residents look at that as a goal to try to strive for?
I would not recommend that. I mean, we will continue to monitor disease activity, increase testing to make sure that we have a full understanding of disease activity in the community, and are using that information to make well-informed decisions about normalizing activities.
We're seeing on the DHEC website that a lot of our counties are showing increased hospital bed usage, some over 75% now. Is that something you guys have as a concern?
Well, that's probably an indicator that we originally asked hospitals to cancel elective procedures. So, so my guess is that if you're seeing a change in increased utilization in hospitals that are not attributed to COVID-19 infection, some of that may be that I believe, as our hospital representative spoke earlier, that there were some procedures that were delayed for a period of time, and now there are some procedures that are not entirely elective that should not be delayed further, so they are beginning to resume some hospital care that is using beds.
In the future, because I know right now we're trying to just tackle this thing here, but we're going back to the disparities amongst minority communities and rural communities. What do you all think should be in place to make sure that, you know, that for the next virus that comes along, healthcare isn't the biggest concern for these communities of color in rural areas?
Well, we're working with our healthcare systems, healthcare providers, to identify these gaps in healthcare, and so that not just for the COVID-19 response, but that we are paying attention to this in the future. We're currently enhancing our plans to prepare for future pandemics or for other emerging infectious diseases to make sure that that the healthcare system can address those gaps in healthcare that we're identifying now.
Governor McMaster, I have a question on the side of reopening. I know we spoke about it yesterday about restaurants reopening, and I know the mayor of North Myrtle Beach was speaking about some protocols that may be in place. Is that something that you all may be looking at as a mandate, as a part of, I guess, getting your A rating as a restaurant, making sure that you're following new protocols, having hand sanitizer?
We haven't gotten that far, but all of those kinds of things are under consideration. We're getting information from excuse me, a variety of areas, as you know, from seeing what we did today and what we did yesterday, to make those. There are a lot of factors, as we described yesterday. So we'll be looking at all of those to make the right decision. But we want to get back to work as quickly but as safely as we can. And one way to be sure that, one way to enhance the good health of the rural areas is to get telemedicine, telehealth, and get businesses to invest, to have factories, plants in a lot of our beautiful rural areas. A facility with 400 or 500 workers, happy workers earning a good pay makes a big difference in our rural areas. And so all of those are part of the South Carolina plan to see that all our people have great opportunities for good health and good jobs.
Governor, do you have an expectation on CARES Act will be spent? Do you have any ideas of how you would want to see it?
Well, those funds come with instructions and directions and limitations on how they're spent. But we want to be sure that that everything is spent wisely to the extent that we have flexibility, and we will get a lot of advice from the General Assembly as well as people in these meetings. To the extent we have flexibility, we want to put the money where it counts.
Governor, do you know if we may be seeing this week or next week some more businesses start to reopen as far as what our progress has looked like so far?
I know that many of them do want to reopen because we get inquiries from many. I'll remind you that we took a little bit of a different approach from some of the other states. Rather than closing as many as we could, we wanted to close or limit or restrict as few as we could. So we concentrated on those where you have the most opportunities for the spread, for the contagion, and those were the close contact things like barbershops and beauty parlors, of course, restaurants and those things. But there are a lot of factors, a lot of details, from the spacing of tables to the menus to the salt and pepper shakers to paying in cash or credit card or calling the orders. There are just a whole lot of factors involved in all of those things, as well as a lot of the restrictions and regulations that are imposed for licensing purposes. But I would encourage everyone that is waiting, wanting to reopen, to take a look at the list of those businesses that are still restricted or in any way. And if you're not on the list, then you may proceed on.
Are you worried that once things do start to open, people are going to kind of open the floodgates and just...
No, ma'am, not worried about that, because that's not how we're going to do it. As has been described here today, we had a very gradual, measured, deliberate approach based on many factors and insights as the virus spread among us, and we are going to use that same careful procedure going out. But we want to be sure that the businesses in South Carolina, business is South Carolina's business. The way you have good schools, the way you have good hospitals, the way you have all the good things, you have to have businesses that are paying taxes and people that are paying money to go to those things. So we want to be sure that our economic growth continues. We were on way at the top in the country when the virus hit. We want to get back to that and beyond, but we want to do so very carefully because we don't want any more people to get sick. We know it's going to happen. We know they're going to get sick, and we unfortunately we're going to have more tragic deaths, but we want to get back to full economic strength and vigor as quickly as we can, but it must be done carefully and safely. And that's why we're receiving recommendations from these people that you see, these very knowledgeable people that you will see here and in other places. That's why we're doing it the way we're doing it. We want the people of our state to have confidence and understanding as to why we're doing what we're doing. So when we make these decisions, they'll understand why and have confidence in them.
Two more questions. Governor, there's reports that Darlington's going to have races on May 17th and May 20th.
Wouldn't that be wonderful?
What are your thoughts on that?
I think it's great. But those kind of decisions are being made, I understand now, all around the country. I know the Heritage, the RBC Heritage, has made their decision and their announcement June the 18th through the 21st, I think, at Hilton Head, and that's great. I hope that NASCAR and others will make decisions and announcements when the time comes, and I hope those that are interested in doing it here will do it.
You can't confirm those reports.
No, sir.
Governor, do you have any opinion on our essential workers who are still going? Should they be receiving hazard pay, do you think, right now, as we still are limiting what businesses are open?
I think that is up to the institutions and advice and recommendations from the hospitals and others. But that's not a government decision at this point.